Our firm, we work a lot on patient experience and helping systems do patient experience strategy. But we also do a lot of crisis work, and it takes one photo or one story to go viral before you realize that you're in a situation that's much bigger than you could have ever imagined or quantify, for that matter. And the reputational damage that could do could be extreme. So when I hear Deming talk about the unknowable and the unknown, and the multiplying impact of satisfaction or dissatisfaction, I think it's a good lesson for us that that an unhappy or a happy customer can do incredible multiplying good or damage to your brand and your reputation, and ultimately your bottom line. It's like, I certainly don't want to downplay the importance of metrics. Measuring our progress is very important. I think it's one of the most important pieces, in that we're able to show that these things work, these strategies work. But that being said, not everything can be measured. And when you think about the impact of a terrible situation, a tragic situation that's handled poorly, and how that can spread, it's hard to quantify, but there are some things you can do. And so, thinking through this, are your employees trained to recognize dissatisfaction and to respond, to have a service recovery program in place that you can intervene early and that you can see that? I would also say that for the most part, the public, in a situation where maybe a story does get attention or traction, for the most part, people want to know that you're responding to that genuinely. And so how you respond in those moments, whether it be a social media post or whether it be a story that picks up media attention or social media attention, how you respond can have a big impact on that. And so thinking through the implications of saying nothing or not responding, or what the impact that it can really make to say, hey, we're sorry, we messed this up. We didn't handle this as well as we could have, and here's how we've learned from this, or opportunities. I would also say that organizations that have an emphasis on communication and the importance of communication, it's not just communicating with patients, but the colleague interaction that it takes to identify issues early and to elevate those through the organization, and then to be able to respond quickly when there's an impact. So focusing on communication is always a smart idea. So really, those three things: service recovery, making sure our organization is responsive, and then focusing on communication as well, could be a great impact and a big help in that case.